Hi, I'm Sean Bennett. I'm a general surgeon. Work in the Department of Surgery at Queen's and KHSC. I primarily specialize in cancers of the liver, pancreas, bile duct, and as well as doing general surgery. And acute care general surgery as well. So I was able to get the Clinical Professional Development Fund from SEAMO. So this is, I'm going to be using this as an opportunity to develop my skill set in robotic surgery. So in my training in general and surgical oncology and HPB surgery, I did a lot of open surgery as well as laparoscopic, but really no robotic surgery. Robotic surgery is a newer surgical platform being offered that can allow for minimally invasive surgery for a lot of procedures that we typically do open. And so here in Kingston, this is already being used by a number of sort of surgical disciplines, primarily the colorectal surgeons, but also the gynecologists and urologists and our thoracic surgeons have recently started a program. And my hope is to develop a program for sort of upper abdominal cancer, so liver, pancreas, stomach, bile duct. And so I'm going to be using this fund to do some training, visit some centers who do a higher volume of these surgeries, and take some courses. Our local experts here, mainly the colorectal surgeons, on how they use this technology to do their operations, and then ultimately hopefully offer this technique to patients in southeastern Ontario with hepatobiliary and pancreatic cancer. As a surgeon, I'm always interested in developing my technical skills, whether that's to allow for curative cancer operations for more patients where it wasn't possible before, or also to offer a less invasive procedure for types of cancers that I already do. So this is a really good example of both those things. I think this will allow us to do both those things, operate on more patients and do it in a less invasive way. I think overall in the field of surgery, this is really moving towards using this some type of robotic platform. I think probably towards the end of my career, a lot of the operations we now do open we'll be doing robotically or minimally invasively, and specifically to the type of cancers that I treat, this robotic platform is being done in a few centers in Canada, but fairly early on in its infancy. So it's pretty exciting to be able to learn these procedures and eventually roll them out in a safe and really impactful way here in Kingston, and be somewhat of an early adopter, hopefully, of the technology that I'm sure will be pretty widespread eventually. I think it's always in any job really meaningful to have an institution that supports the development of doing new things, whether that's research or developing new clinical programs. It's pretty easy to continue doing things the way we've always done them, but really to push the boundaries and impact and improve care, I think we need to develop new things, and we really can't do that as very easily as individuals. We really need support of our colleagues and our institutions. So it really feels pretty special to have an institution that supports that.